My team and I present DermAI, a project from Ministry of Ayush. It is a website that uses AI for the diagnosis of dermatological diseases. Multiple challenges are faced in underserved areas where they don't have access to dermatological care, doctors, and tools. Our project solves this major issue, and alongside, we also provide telemedicine integration, where users can connect with healthcare professionals for further guidance and treatment. In the website, users can input the picture of the dermatological disease, and optionally, they can input symptoms that they are facing too. And once it's submitted, details of the identified disease will be displayed. Now I call upon my teammates Sanjay and Dhyanesh to explain the workflow.
We are going to discuss the workflow of DermAI. The first is the user input. User input consists of two things: image input and symptom description. Here, the user tends to upload of a pic where the actual disease has been identified, and also he has to the symptom description is optional, where he has to put in the textual description of the symptoms, where this is, where the symptom is, and whether it has some redness or itching sort of things. So to move on, the next is image processing. Using OpenCV and TensorFlow, image enhancement is done so as to brighten the quality of the image. Next is the natural language processing analysis. Here, using a BERT library, the textual description is processed and the accuracy is made more better. The next is the basic assessment. The basic assessment consists of two things: feature identification and feature extraction. Based on the symptom analysis and the image processing, the features are identified as a basic, which is taken from the data set by the model. And the second thing is feature extraction. Based on the features identified, the model compares from the image input and the data set, and it extracts what are the features of the disease. So as to continue, I would like to call Dhyanesh to continue with the flowchart.
So the next is disease diagnosis. The app's AI system compares the extracted features or symptoms information with a vast database of known skin disease and their associated characteristics. This database could include images, medical records, and diagnostic criteria for various skin conditions. And then machine learning models. From the extracted features, the disease is diagnosed by mapping from the dataset. Then diagnosis output. The model represents the users with a list of potential skin disease diagnoses, typically ordered by accuracy levels. Each potential diagnosis is accompanied by detailed information about the condition. The output contains disease name, accuracy, treatment options, recommendation, and additional resources. The additional resources, telemedicine integration, facilitates communication with skincare professionals related to the disease.
DermAI is a revolutionary field combining AI and dermatology. It uses convolutional neural network for preliminary skin condition diagnosis. It enhances the healthcare accessibility through telemedicine and making it convenient and breaking geographical barriers. DermAI educates the public about skin health and aids in early skin cancer detection. Advanced algorithm analyze skin images with remarkable accuracy, aiding diagnosis. It helps with timely intervention, prioritizing cases based on severity. It also detects occupational dermatitis early, promoting a healthier work environment. Overall, DermAI's fusion of AI and dermatology, led by CNNs, improves skin condition identification precision. DermAI is transforming dermatological care with its precision diagnosis powered by advanced algorithms like CNN, ensuring trust and reducing anxiety of patients. Offering convenient access through remote image capture, it breaks down geographical barriers, optimizes the triage for efficiency, and has the potential to make dermatological care more cost effective. In sum, DermAI reshapes patient centric care and stands as the future of dermatology.
Derm AI has the potential to revolutionize how we view skincare, but to understand this journey, we must first understand its key discrepancies. So, the first one is the basic thing, the backbone of Derm AI, the data collection. So, Derm AI requires a substantial amount of data in order to work properly. So, let's take this as almost assembling the pieces of a puzzle. So, the more number of pieces we have, the more comprehensive and descriptive our data set is going to be, and the more clearer our diagnosis is going to be. The next one is internet connectivity. So, as specified before, DermAI offers the option of telecommunication. And in order for this telecommunication to take place properly, we need a very stable internet connection, without which this is impossible. The next one is accessibility. DermAI aims at providing a user friendly interface, and it aims at making things easier for people and more accessible. So in order for that to happen, we aim to provide a user friendly interface with more easier features so that they can access it more easily. And the last one is data bias. So let's imagine Derm AI as a global feast. And in order to cater to everyone's taste, we need to make sure that we add more things to the menu. So adding more amount of data into the data set and making it more clearer and inclusive for people of all types. This makes our diagnosis much more clearer.
Here we have the homepage of DermAI. The homepage consists of an upload here button where the user can click on it and upload the picture of the skin disease that they have. And alongside, they can give description of the symptoms as well. And once that's done, they can click on submit and it takes them to the next page where the diagnosis is presented. This screen shows the disease name, the accuracy of the diagnosis, and along with that, there are four other things that we provide, which is diagnosis information. It gives the brief description of the condition and also info about the severity. The second one is the treatment options. It shows the available treatment options for this particular disease and recommendations as well. It gives suggestions, to modify the lifestyle, the skincare routines, and stuff like that. Additionally, we also offer links to trusted medical organizations or associations related to dermatology. And there are a few other static pages where click on About Us. It shows about our project, which is DermAI, and services that we provide as well. It's another static page. And we also have the third static page, which is Contact. And this is general information about us, how they can contact us, and feedbacks and stuff. Once you click the home button here, it takes them back to the home page where you can upload the next image and then keep going.
DermAI, innovating dermatological care in India. It introduces novel approaches to dermatological care aligning with the Health Ministry's goals. Its keys novelty include enhanced access and efficiency. It offers remote dermatological care, reducing in-person visits for improved accessibility and cost efficiency. Relief for facilities. Its remote diagnosis ease healthcare facility burdens, optimizing resource allocation. Occupational dermatitis focus. It addresses occupational dermatitis aligning with the ministry's commitment to workers' health. DermAI is at the forefront of innovative healthcare, advancing dermatology while meeting India's unique healthcare challenges.